You won't believe what your eyes can tell you until it's too late. A sudden blur, a flash of darkness, vision that splits in two. Most people dismiss these as eye strain or fatigue. But in my 30 years as a stroke specialist, I've seen far too many patients ignore these subtle signs only to wake up in the emergency room, or worse, not wake up at all. I'm Dr. Jonathan Myers, and what I'm about to show you could mean the difference between full recovery or permanent brain damage, because before a stroke strikes your brain, it whispers through your eyes. Let's uncover the hidden stroke warnings your eyes are trying to show you before it's too late. Let's begin with one of the most overlooked warning signs: blurred or foggy vision in one eye, especially when it comes on suddenly. It may feel like you're looking through a dirty window, or like someone just smudged your glasses. Some describe it as a thin film, others say it's like a soft fog, rolling and dulling the edges of everything. But here's the key. This type of blurriness often affects just one eye, and it appears out of nowhere. This isn't normal aging or tired eyes after staring at a screen. This could be your retina's blood flow being blocked, and that may signal a transient ischemic attack or a mini-stroke. It means a clot may have temporarily interrupted oxygen to your brain. Many patients ignore this because it fades within minutes, but that's exactly why it's dangerous. A mini-stroke is your body's final warning, and the next one could be much worse. Let me tell you about Mr. Thompson, a 65-year-old patient of mine. One morning, while reading his paper, his left eye suddenly went blurry. He blinked, rubbed his eyes, even splashed water on his face. It cleared up after 10 minutes, and he assumed it was nothing. Thankfully, his wife insisted he see a doctor. A scan revealed multiple narrowed arteries in his brain. We intervened immediately with medication, lifestyle changes, and monitoring. That blurry eye. It saved his life. If Thompson had brushed it off, the next week could have ended in a full-blown stroke. So here's what you should do. If you experience sudden blurring or fog in one eye, stop what you're doing. Use a mirror. Check for uneven facial muscles. Try smiling. Lift both arms. Speak a simple sentence. If anything feels off, call 911 immediately. This isn't just an eye problem, it's a brain warning. Let's now move to another sign your eyes might give you, one that's even more alarming than fog: complete darkness. Now let's talk about something far more dramatic and far more dangerous than blurry vision: sudden, complete loss of vision in one eye. Imagine this: you're getting out of bed, reaching for your glasses, and suddenly your right eye goes completely dark. Not dim, not foggy, but pitch black, like a curtain has dropped over it. Most people panic for a moment, then wait, hoping it passes. And sometimes it does. Within minutes, your vision comes back. That's what makes this symptom so deceptive and so deadly. This isn't an eye problem, it's your brain screaming for help. When one eye suddenly goes blind, even temporarily, doctors call it a retinal artery occlusion, and it's often a sign that a blood clot is blocking circulation to part of your brain. Think of it as a warning stroke through the optic nerve, and studies show that up to 1 in 3 patients who experience this go on to have a major stroke within days or weeks if they don't get medical attention. Let me return to Mr. Thompson, the man I mentioned earlier. 2 weeks before his hospital visit, he had a brief episode while walking his dog. His left eye went completely dark for about 30 seconds. He thought it was just low blood sugar and brushed it off. But when we looked deeper, arterial scans revealed plaque buildup near his carotid artery, narrowing blood flow to the brain. That 30 seconds of darkness was a life-saving signal. Because he came in early, we were able to begin anti-clot medication immediately, and he's stroke-free to this day. Here's the bottom line: if one eye suddenly goes dark even for 30 seconds, don't wait. Use a mirror to double-check your facial symmetry. Lift your arms, speak a full sentence. If anything feels off or if the vision doesn't return immediately, call 911. This kind of vision loss is never just a fluke. It's your body's red alert. And in the next part, we'll talk about another hidden symptom your eyes may reveal: double vision, and why it's more dangerous than you might think. We've talked about blurry vision. We've talked about sudden loss of sight in one eye. But what if your vision splits and you suddenly start seeing double? Double vision, also called diplopia, can feel surreal. You glance at your phone and see two overlapping screens. You try to read a sign across the room, and the words appear stacked, ghosted, or drifting apart. Now, if this happens after a few too many drinks, you might laugh it off. But if it happens suddenly while sober, and especially if it's just one side or comes with dizziness or balance issues, your brain could be in serious trouble. Here's what's going on behind the scenes. Your eye movements are controlled by 6 tiny muscles, all orchestrated by cranial nerves deep inside your brainstem. If blood flow to these nerves is disrupted, the muscles get confused. One eye moves normally, the other lags or drifts. The result: you see two of everything. This isn't just annoying, it's a possible sign of a brainstem stroke, one of the most dangerous and hardest to detect types. And here's what's terrifying: many people dismiss double vision as just tired eyes or a vision problem. But if the root cause is neurological ignoring, it could mean missing the critical window for stroke treatment. Let me tell you about a patient I saw. Barbara, 62 years old. One morning, she noticed she couldn't focus on the cereal box in her pantry. The letters were doubled and floating. She took a nap, hoping it would pass. By evening, she had trouble walking in a straight line. When she finally came to the ER, scans revealed a small stroke near her midbrain, the part that coordinates eye movement and balance. Fortunately, because she acted in time, we were able to reverse much of the damage. But not everyone gets that second chance. Here's the takeaway. If you suddenly develop double vision, especially with imbalanced facial droop or slurred speech, don't wait. Use a mirror to check for other fast signs and call 911 immediately. And coming up next, we'll talk about a symptom that doesn't blur or double your vision. It just takes the light away completely. Yes, we're talking about sudden darkness and what it could mean. Now let's talk about one of the most alarming and most often misunderstood stroke warning signs, that moment when the world goes dark, but only in one eye. Some people describe it like a curtain being pulled down. Others say it feels like a dimmer switch turning off the lights in one half of their vision. It doesn't hurt. It doesn't come with warning. It just happens. This frightening symptom is called transient monocular blindness, sometimes referred to by doctors as amaurosis fugax. But you don't need to remember the medical term. Just remember this. If one eye suddenly goes dark, even for a few seconds, this could be a mini stroke in action. Here's the science. Your eye is supplied by the ophthalmic artery, a direct branch of your internal carotid artery, which also supplies blood to your brain. If a small clot or plaque blocks this artery, even for just a moment, vision can vanish like a light switch flipping off. And while it might come back in seconds or minutes, the danger isn't over. Because this isn't just about your eye. It's a flashing red warning light that a major stroke could be next. Let me share a real story. A retired mechanic named Thompson, 65 years old, told me how one morning he blinked and suddenly the right side of his vision turned black like someone had dropped a curtain. It lasted about a minute. He almost ignored it until he remembered seeing one of our stroke awareness videos. He grabbed a mirror, checked his face and speech, and while everything seemed normal, he still called 911. At the ER, we found a nearly blocked carotid artery. He had surgery that same week to prevent a future stroke. That mirror and that decision may have saved his life. So if you ever feel a shadow fall over one eye, don't brush it off. Don't wait for it to get better. Act immediately. Coming up next, we'll tie all of this together and show you how using just a mirror and 60 seconds can help you catch a stroke before it strikes. A mirror. Something so simple, so ordinary, yet it might be the single most powerful tool in your home for detecting a stroke before it's too late. Here's why. When a stroke begins, the first signs often show up on your face, and they're not always obvious to you. You might feel fine until you look in the mirror and notice one side of your face is drooping, your smile is uneven, your eyelid looks heavy, or your gaze feels off. It takes just 60 seconds to do a full check. And in that single minute, you could discover a life-threatening emergency. The mirror lets you see what your brain might be hiding from you. Strokes can impair your awareness, your judgment, even your perception. But the mirror doesn't lie. Pair this with the fast method face-arm speech time, and suddenly you have a fast, affordable, and effective way to check yourself or a loved one when something feels wrong. Keep a mirror by your bed. Put one in your purse, your car, your office desk drawer. Because when a stroke hits, every second counts. A 10-minute delay can mean the difference between full recovery or permanent damage. And once symptoms start, your window for effective treatment, especially with clot-busting medication, is only about 3 to 4.5 hours. The earlier you act, the more brain you save. This is not just theory. Patients like Thompson, who used a mirror to catch facial changes before symptoms worsened, are living proof. So if you've watched this far, don't wait. Place a mirror within reach. Show your loved ones how to use it. It could mean the difference between walking away or being wheeled in. Coming up next, I'll leave you with my final advice and a message I hope you'll carry with you for the rest of your life. Your eyes are more than windows to the soul, they're also windows to your brain. When something disrupts blood flow to your brain, your vision is often the first to notice. Blurred vision, sudden darkness, double images, none of these should ever be brushed off. In fact, your eyes are the only place in the body where doctors can actually see blood vessels directly without surgery. That's why any visual disturbance, even if it goes away in minutes, might be the only warning you'll ever get before a stroke hits. Many stroke survivors later say, "I thought it was just my eyes being tired." But a tired eye doesn't cause your whole visual field to go dark. A tired eye doesn't make one side of the world vanish. These are not optical issues. They're vascular. And the key lesson here, time. If you act within the first hour, ideally within the first 10-15 minutes, your chances of a full recovery skyrocket. But if you wait hoping the symptoms will fade, the damage could be permanent. So please take your eyes seriously. If anything looks off, even just for a minute, treat it as an emergency. Call 911. Tell them you may be having a stroke. I'm Dr. Jonathan Myers. I've spent over 30 years helping patients like you survive and recover from stroke, and I want to help many more. If you found this video helpful, please like, subscribe, and share it with someone you love. It helps us reach more people who need this life-saving information. Your eyes could save your life. Make sure they have the chance to.